even the non-doctors among us can understand that if one machine is pumping oxygen into the lungs of 2 patients, that can't be calibrated to the needs of each patient individually. Each patient is going to get what the other one is getting because the machine can't do 2 different things at once. Not if it's one machine designed for one set of lungs and you're just splitting the air tube. And so by doing this, by having to do this already, American hospitals already are turning this sophisticated, life-saving machine for the sickest patients into this blunt instrument that can maybe do this job, but maybe not. But what are you going to do? What are you going to do? One New York doctor telling the New York Times tonight, quote, "Nobody believes this is the best way to ventilate somebody. This is for the doomsday scenario. It is suboptimal, but the other option is death." The shortage of ventilators is real, but it does not need to be this dire on the front lines this fast. I mean, not every ventilator in the United States is in use right now. So why are they already having to split them experimentally at New York Presbyterian? They're having to do that because even though every ventilator in the U.S. isn't in use, the ones that need, the places that need them can't get them. There isn't any national coordination of how we're using them. And so we're not maximizing the use of the ones that we've got. Frank Kendall, who served as Undersecretary of Defense for Acquisition and Logistics in the Obama administration, tells the New York Times tonight, quote, "This is a national crisis. In a time of scarcity, you can't leave it up to companies and governors to manage it themselves." The Times says, quote, "What is really needed, a number of public health experts and former government officials say, is for Washington to take control of the nation's existing ventilator supply. Because peak coronavirus infections will hit cities and regions at different times in the coming months, a centralized federal effort could send unused machines to hospitals that need them most." We could do that if we had a national response to what's happening in our country. We could be doing it that way if there was a federally led national response to this crisis. But instead, it's every state for themselves. It's everybody who wants to help for themselves. And so, okay, veterinary hospitals, do what you can. See if that might help. Washington Post reporting tonight that on a conference call between the president and the nation's governors, the president once again said that as far as he was concerned, the role of the federal government is to be, quote, backup for the states. Washington State Governor Jay Inslee reportedly told the president in response, quote, "We don't need a backup. We need a Tom Brady," meaning we need a quarterback. We need the federal government itself to be using its unparalleled sole power to mandate the production of critical medical supplies and to coordinate their distribution, to get them distributed where they need to be without the states doing it themselves, all 50 of them, all at the same time, fighting it out among themselves and even fighting it out with the federal government in competition over who will pay the highest price. The Post reports that the president responded to Governor Inslee by being, quote, defensive of his efforts. At least he's defending someone.